Can you imagine a world where dangerous fibers that have been linked to cancer are suddenly allowed back on the market? A world where fossil-fueled factories belch toxic fumes without restraint, all in the name of health. You might think this is some dystopian fiction, but according to recent developments, it just might be our current reality. That is the shockwave rippling through countless communities, as controversial policy moves by Robert F. Kennedy Jr., America's new Secretary of Health and Human Services, and former President Donald Trump treat the words healthy again more like a punchline than a serious commitment. Today we dive headfirst into a tangled web of asbestos, coal plants, restricted scientific research, and vaccine skepticism, all swirling into one huge storm that could have dramatic real-world impacts. Our mission? To unravel this perplexing story and see how these policies might reshuffle the very foundation of public health in the United States. Stick around, because in this in-depth exploration, we will examine the potential consequences of bringing asbestos back, go behind the scenes of dirty coal plants that simply refuse to shut down, investigate questionable cuts to Medicaid, and so much more. Along the way, we will also talk frankly about vaccine misinformation and how it could open the door for more disease outbreaks. By the end of this, you may be asking yourself, when politicians say healthy, just whose version of health are they talking about? Let us begin with the asbestos controversy that has left many Americans slack-jawed in disbelief. It all began when the Environmental Protection Agency under the Trump administration filed documentation indicating a reconsideration of a ban on chrysotile asbestos, an infamous substance tied to serious illnesses such as cancer of the ovary, lung, and larynx. The staggering part is the scope of the consequences. Asbestos has been widely documented as dangerous for decades. Historically, thousands upon thousands of people who worked in shipyards, construction, or even auto repair expressed frustration and heartbreak at the slow recognition of the hazards that lurked in these seemingly innocent fibers. Now, in an extraordinary twist, the federal government might roll back that ban, or at least stall its enforcement for many months, possibly more than 2 years. Think about that timeline. Supporters of this shift claim it is needed for further study and economic considerations, while staunch opponents worry about what even a few months of unregulated asbestos exposure could mean for public health, especially in older buildings, schools, or factories where asbestos-containing materials might make a comeback. This is happening even though organizations such as the Asbestos Disease Awareness Organization have sounded the alarm that real lives will be at risk from this abrupt reversal. Even a short delay could be the difference between safety and tragedy for people working in environments where asbestos is easily inhaled. It is alarming enough that asbestos may be on the brink of a national comeback, but it is just the tip of the iceberg. Another huge problem is the administration's approach to coal plants, specifically those in Michigan that contribute massive amounts of carbon dioxide, sulfur dioxide, and toxic particulate matter into the air and water. For many states, the closure of such plants has been an ongoing push, designed to protect the environment, reduce greenhouse gas emissions, and improve the health of local residents who suffer from high asthma rates or other pollution-driven conditions. What is more shocking, these plants often create irreversible damage not only to the atmosphere, but also to waterways, seeping arsenic and heavy metals into the drinking water. Yet, bafflingly, the Trump administration has fought to keep 2 such facilities in Michigan operational, defying state officials who say they have more than enough energy capacity to meet current demand. People living in the shadows of these coal giants have expressed growing fear about possible spikes in respiratory illnesses, or even other long-term health effects that might be traced to ongoing pollution. The question on everyone's mind is, why preserve inessential coal plants with questionable economic justification and a well-documented negative impact on human health? This pattern expands beyond Michigan. Starting years ago and culminating in new executive orders, there has been a push to keep coal plants open across the country. Advocates of these decisions often argue that they are crucial for jobs in the energy grid. However, scientists who have studied the toll of air pollution on communities are not impressed. Their research indicates that the continued burning of coal is linked to a staggering number of premature deaths over the years. Indeed, imagine how many people might be alive today if air pollution from these massive plants had been more responsibly managed. But the narrative of questionable choices does not stop with asbestos or coal. Consider the issue of drinking water, a basic necessity. Most Americans expect the water coming out of their tap to be clean, regulated, and safe for daily use. Yet, under the Trump administration, the Environmental Protection Agency shrank the definition of which waterways would be protected by the Clean Water Act, scaling back significantly from the expansions implemented during the Biden years. This means that not all bodies of water are guaranteed federal safeguarding from construction runoff, livestock waste, or other pollutants. Think about what that implies for rural communities and people living near newly unprotected streams or wetlands. The suspicion and anxiety are palpable because water supplies in those areas could now be more vulnerable to contamination. Exacerbating that concern, the administration has also lifted limitations on so-called forever chemicals, which include certain compounds that have been linked to conditions such as developmental issues in children and higher risks of cancer. If these chemicals, once restricted, can again leach into the water supply unchecked, the potential health costs could be enormous. Medical access is another battlefield for public health in this labyrinth of policy. Imagine you are living in a place where your primary access to medical care depends on insurance through Medicaid. Now imagine that coverage being ripped away through proposed budget cuts. That scenario, once hypothetical, has become a stark possibility, with the administration's spending priorities threatening to remove insurance from millions of individuals. For many families, especially those contending with chronic illnesses, slashing Medicaid is akin to a death sentence. The scale is so vast it can seem unreal. Experts have warned that real fatalities could result from people losing critical treatments, surgeries, or basic checkups. We cannot forget the chilling saga of Cancer Alley in Louisiana either. This heavily industrialized region has seen the presence of pollutants like chloroprene, which the Environmental Protection Agency classified as a carcinogen. Under the Biden administration, lawsuits were filed to hold certain manufacturers accountable for the dangerous toxins that threaten local communities. But, under Trump, that legal momentum abruptly stalled. Imagine living in a place so synonymous with cancer cases that it earned the name Cancer Alley. Now, imagine the federal government backing away from its attempt to protect you via legal mechanisms, leaving you feeling trapped in an invisible toxic cloud, powerless to ensure your children are safe. These stories are sobering, but do not take this as an invitation to despair. Instead, let us transform our collective shock into a quest for understanding. If you find yourself caught off guard by these revelations, take a quick moment to show a little support for ongoing discussions about public health. If you like discovering the hidden truth behind official statements, you can always let us know by sharing your thoughts. Every bit of engagement keeps important conversations like this one alive. The perplexing policies stretch deeper into everyday life, from the food we eat to the research that fuels tomorrow's cures. For example, the administration has undone programs that allowed schools and food banks to buy fresh produce from local farmers. When the COVID pandemic disrupted supply chains, these measures were introduced to keep children fed with minimally processed sustenance. Yet, ironically, the politician who constantly talks about the dangers of junk food has remained silent, or even complicit, when those beneficial programs were tossed aside. Many parents and dietitians alike are left wondering why the emphasis on healthy decisions always seems overshadowed by policies that could produce the opposite effect. At the ground level, such program cancellations might mean that school cafeterias will revert to packaged meals shipped from miles away, loaded with artificial preservatives. Food banks, entities that provide a lifeline to those in need, could be forced to choose between more processed foods or fewer donations. That might seem like a minor detail in the grand scheme, but for families that rely on nutritious lunches at schools, it is no small matter. Indeed, well-balanced meals can help children excel in the classroom, reduce health risks like childhood obesity, and instill positive eating habits that last a lifetime. That is why revoking these local farm partnerships raises serious questions about national priorities. Speaking of national priorities, let us turn our eyes to scientific research, particularly around life-threatening diseases like cancer and debilitating conditions such as Alzheimer's. Historically, the National Institutes of Health have been crucial in funding groundbreaking discoveries. From new treatments that may extend the lives of cancer patients to innovative therapies that could one day stop Alzheimer's in its tracks, federal grants often spark the breakthroughs that shape modern medicine. But in recent months, under the new administration's guidance, we have observed a drastic downturn in these grants. Hundreds of awards have been canceled or delayed, with some scientists left in limbo, their laboratories underfunded, staff uncertain about whether they can continue their research. Why is that so dangerous? Because scientific projects do not proceed at the flick of a switch. They require years, sometimes decades, of consistent research. Halting funding midstream can devastate the pipeline of solutions for diseases that kill thousands of Americans every year. In the meantime, the administration has expressed interest in slashing billions of dollars from the budget, which threatens to hamper everything from immunology breakthroughs to advanced treatments for rare genetic disorders. Given that vicious pattern of cutbacks, one might legitimately wonder how many future medical miracles will never see the light of day. Perhaps nowhere is the tension around scientific knowledge more polarizing than in the domain of vaccines. Vaccines have, historically, stood among the greatest achievements of modern medicine, credited with all but eradicating diseases like polio in numerous regions. However, the fervor of vaccine skepticism, stoked by Robert F. Kennedy Jr., has begun to reshape the landscape of public health policy. He has reportedly replaced panels of vaccine experts with individuals who cast doubt on well-established immunizations, from the measles, mumps, and rubella, shot all the way to important boosters for pregnant women. The rhetoric from the new leadership includes claims questioning the safety and necessity of shots around the globe, even though entire communities, especially children in impoverished nations, depend on them to survive. From Africa to Southeast Asia, organizations that work to distribute essential vaccines are confronting the chilling reality of losing vital financial support from the United States. The question arises, is the administration writing off the direct correlation between immunization and survival rates among the most vulnerable populations? This anxious uncertainty extends also to domestic fronts. Experts from the medical community fear that bashing established vaccine guidelines could lead to surges in once contained diseases. The measles outbreak is already a real example in certain areas, flaring whenever communities become under-vaccinated. Listening to some public statements, where individuals close to the administration tout antibiotics for viral infections, shows a glaring lack of understanding about fundamental medical concepts. On top of that, we see questionable scientific voices brought into official circles, adding confusion instead of clarity. We must not overlook pandemic preparedness, a subject with renewed urgency after the COVID crisis. You might assume that after a global pandemic, the main lesson would be that we must stay vigilant, maintain robust disease surveillance, and have contingency plans. Yet top virologists warn that the current administration's cuts to public health funding at local and state levels have left the nation far less prepared than we should be. With the new leadership seemingly treating the threat of emerging pandemics lightly, there are widespread concerns that if another formidable virus sweeps across the globe, the United States may be tragically unprepared. On the rhetorical front, that same administration has minimized measles outbreaks, disregarded best practices for containing them, and toyed with halting the pursuit of critical specialized vaccines that could protect us if a new influenza virus or another pathogen emerges. That is a precarious stance if we care about protecting at-risk populations, particularly children or the elderly. Meanwhile, if you find yourself feeling outrage or disbelief, it might be the perfect moment to quietly support those who are expanding awareness about these issues. If you appreciate getting to the root of controversies, consider lending your voice, whether by encouraging more conversations or staying updated on policies that affect your community. It can be as simple as telling a friend, because informed citizens are the backbone of any meaningful effort to hold leaders accountable. Let us circle back to some of the underlying contradictions in Kennedy's approach, as it is truly perplexing. One moment, we see him positioning himself as an ardent critic of artificial dyes or processed foods. In principle, that is not necessarily bad. Many nutritionists also champion fresh, wholesome diets. But how does that align with staffing an expert panel with vaccine skeptics, or firing professionals who have dedicated their lives to understanding public health? Skeptics might suggest that the real game here is about fueling conspiracy theories or aiming for short-lived political gains, rather than consistently promoting holistic well-being. Healthcare professionals, who have spent years learning about how to prevent disease through immunization and balanced living, are finding themselves sidelined by policymakers who appear more fascinated by contrarian claims than by standard scientific consensus. This does not mean that governments should never question mainstream science, but turning an entire national health strategy into a fiasco built on misinformation is not exactly a recipe for success. That is particularly true when you are dealing with highly contagious diseases that can spread rapidly through undervaccinated communities. Then there is the bizarre reality that, while championing some anti-industry stances in one breath, the administration endorses or tacitly excuses a preference for historically hazardous substances and pollutants in another. For instance, one might ask, why initiate a crusade against synthetic food dyes while going easy on laws that keep asbestos out of buildings? The mismatch is jarring, and the potential mass consequences for public health cannot be overlooked. When so many legislative and regulatory decisions appear inconsistent, it can breed confusion among the general populace. Some are left threatened by toxic building materials. Others watch as budget cuts hamper their health insurance, and researchers lose the chance to find cures for lethal illnesses. In many ways, Americans in the future might look back on this chapter as a cautionary tale. From the vantage point of tomorrow, the question might be, why did so many people stand by quietly when such glaring contradictions were allowed to pass? The crisis is not just about government decisions. It is about a lack of transparency and the overlooking of vital scientific data by those in power. When we see lawsuits abruptly dropped against polluters, or global vaccine alliances robbed of funds that were once saving hundreds of thousands of lives, we start sensing a generational moral dilemma. To truly grasp how precarious this situation is, consider the notion that entire panels of experts once devoted to analyzing vaccine trials have been dismissed. Think of the impact that has on child health. Are we simply ignoring decades of medical research confirming that immunizations are critical to fighting outbreaks? Or are we prioritizing an ideology of skepticism that might inadvertently open the door to preventable disease epidemics? At the end of all this, we have a swirl of policy changes that some might label contradictory and others might label outright detrimental. But more important than labeling them is understanding the potential ramifications of letting them linger. If asbestos is allowed to stage a grim comeback in factories, if unneeded coal plants remain open, if communities in rural areas start battling newly polluted waters, or if kids get sick because vaccine skepticism took priority, then we could witness a tragic unraveling of decades of hard-earned health and environmental protections. Will this be the path of the future? If so, how can the nation pivot away to a place where science, safety, and well-being come first? The good news is that democracy allows for pushback, whether through the courts, advocacy, or electoral change. These days, it is becoming ever clearer that healthy again is more than a political slogan. It is a question worth dissecting in detail. Which measures truly keep us healthy, and which strategies lure us into complacency with pleasant-sounding but hollow catchphrases? How can leaders reconcile an anti-vaccine stance with a stated desire to preserve American longevity? And are the voices calling for industrial expansions and gutted medical benefits ignoring the inevitable health disasters down the road? The collisions between policy, environment, and human health have never been more evident. Ultimately, it may not be enough to rely on political slogans or partial truths when the stakes are this high. People who wish to see genuine improvements in public well-being might do well to stay engaged, read beyond the headlines, and be ready to question leadership decisions that can erode long-standing protections. If we do not, history may repeat itself. For anyone feeling the weight of these revelations, remember, you are not powerless. Spread awareness, join local groups that focus on healthcare and environmental issues, and stay prepared to vote in ways that reflect your priorities. That engagement, that willingness to dig deeper, is what might yet help tip the scales toward genuine progress. Thank you for exploring these intricate stories with us. We hope this journey into asbestos, measles, coal plants, and more has opened your eyes to some startling developments. Stay curious, stay vigilant, and remember that knowledge is a tool. When wielded wisely, it can drive the changes we desperately need.